Hello, everyone. Thank you for tuning into Agitation Rising. Today, we're going to interview two people who have mental, behavioral, or developmental disabilities about their symptoms, their experiences with police when they were suffering a crisis, and whether they support a police response to mental, behavioral, and developmental crisis calls. Kyle, welcome to Agitation Rising. Can you go ahead and give us your name and how you self identify your pronouns?
Yeah, my name is Kyle Auer, and my pronouns are he, him, his.
And you are a person with a disability. Do you feel comfortable telling us what that disability is?
Yes, that disability is mental. So I have depression, anxiety, and bipolar 2.
Tell us a little bit about how those symptoms affect your daily life.
Yeah, so I have to be on medication every day to make sure that I am functioning properly. I don't have any potential mental breakdowns, and make sure that I'm able to take on daily tasks as usual.
In situations where you've been in crises, how does that kind of how has that manifested itself in the past?
Trigger warning: this is like self harm related, but depression can get a little extreme at times. So I definitely have experienced thoughts of self harm, actual self harm. That's been something that I've actually experienced. I've had thoughts and ideations of suicide in the past. So it's definitely it manifests definitely differently depending on the day.
Hmm. And have you ever been in a situation where like you were having a crisis and you had to like interact with the police?
No, surprisingly not. I was lucky that I could stop myself before it got to that point. Um, so yeah, I got lucky.
But how would you feel if you were going through a crisis and because there's been a lot of talk between co-responders and alt responders about police responding to mental and behavioral health crises. I guess how would you feel if the people responding to whatever crisis you were police? Would you feel comfortable in that situation?
Currently I have like a mixed relationship with the police. I don't really think that they are best suited for these situations. I personally think that mental health professionals are best suited and best trained for these kind of situations. So a co-responder model, I'm not entirely in favor of because not everyone has a good relationship with the police. And if they're having a mental breakdown, that could mean that there's maybe more aggression towards the police or more of symptoms of that breakdown because they're coming in contact with someone who's in power who can harm them in some way instead of someone who will be more than likely to help them through their process.
Yeah. Yeah. Well, thank you so much for taking your time to be on Agitation Rising. We really appreciate it.
Yeah, thank you.
The next person we're talking to today agreed to do this interview under condition they would remain anonymous, and we'll talk in the interview about why they made that choice. We'll refer to this person as SJ, and they go by he, them pronouns. SJ, thank you so much for joining us on Agitation Rising to talk about some of your experiences that you've had. Can you just start off by explaining why you don't feel comfortable um, revealing your identity in this interview that's going to be public?
Ableism mainly. I want to be able to get a job. And then like having like a psychiatric disorder, like a psychotic disorder, is very stigmatizing, to be honest. A lot of people don't understand it, including politicians, as I'll talk about later.
Yeah. And if you're comfortable, can you just tell us some of the mental or behavioral diagnoses that you have or that you deal with?
Uh, Autism is one, but that's developmental. But I have schizoaffective bipolar type, which is basically schizophrenic like symptoms with a mood disorder, and my mood disorder would be bipolar.
And what are some of the coping methods that you use to manage it, whether it's like, medication or like actual therapy or things like that.
Medication and talk therapy, which can work for most people. Some people are meds just don't work for them. Luckily for me, I'm lucky enough to have found a med regimen that works, and that doesn't make me too tired.
Why don't you explain to us some of the situations that you've been in that involve police that kind of gave you, the impression that you have of a kind of police response for mental, developmental, or behavioral health crises?
Uh, I was about to like go into psychosis. I was in mania first. Uh, and then I kept on getting more and more psychotic symptoms. This is the only time I've ever gone psychotic. But
And just to be clear, can you describe what you mean by psychotic symptoms for those that are unaware?
delusions of grandeur. Some people have hallucinations. Others hear voices. Distorted thoughts, paranoia. Sometimes thinking like the government is after to get you. Or I knew when I was in the psych ward, I knew somebody that thought that Transformers were real and they're trying to take over the bodies. Oftentimes, there's also religious based. Actually, that's really common, religious based. Like God is talking to you. I was a frequent flyer, so like I had like police called on me and stuff because uh you know just walking around and stuff. Uh, I don't know. I got it made me paranoid. Uh, because like I didn't trust them to begin with, and that makes sense because like I was psychotic. I wasn't in my right mind, but like I felt like they didn't understand what was going on. Like I was threatened to be taken to jail or like the sixth floor. Which like I'm glad I had the option to go to the hospital instead of like jail, but a lot of people don't have that option. Uh, and then I've had other experiences with family members because it really runs deep in my family.
Hmm. And also, just to be clear for people out there, having to go to being institutionalized is another form of incarceration.
It
Inmate.
is. I wish there was. I would just wish there was a different system altogether because you're locked up. You don't have access to your phone. They monitor you when you call on the phone to people. It's really sucks when you don't have your phone in there to begin with, and then you have nobody to be able to call. That happened to me the first time. Uh, was not fun. Don't recommend it.
So, were there situations where instead of being institutionalized, you were incarcerated?
I went no situations like that. I did go to the state hospital because I was a frequent flyer, so I got taken to mental health court, which is a different like system than like the judicial system.
Mhm.
It's more like preventative.
So, did you feel in your interactions with police that they were very willing to use the potential of violence or the threat of violence in order to get an outcome that they wanted?
Yes, like jail is a inherently violent thing. Like I had experience with a relative that they were psychotic. I was there trying to get them to go, and and all these police came. They just seemed to agitate the situation because one, I don't think it's a good idea to have a psychotic person. Oftentimes, symptoms of psychosis is that you think someone out is get to get you, and seeing a police officer is just going to escalate the situation in and of itself. And my experiences with other people while I was at a stable level, it's escalated every single time. And
So, in situations where, police were involved, did you find that they also were very willing to use deception as a way to get you to comply? Like they would tell you one thing and maybe do another, or they would.
What do you
not
mean like that?
tomorrow. Well, they only gave me an option to go to like places. Yeah. I mean, some of it is like hard to remember because I
Yeah.
don't know if you've experienced psychosis. It's just your brain, like they still have memory problems, like trying to remember the time. But I think they had like an ambulance come one time, and like they told me they're going to take me to the hospital. They didn't tell me they're going to take me to the psych ward. I don't think.
And so there's definitely been a lot of calls lately across the state about putting in coresponder models for, behavioral and mental health crises. What do you think about those plans or that kind of model of dealing with these crises?
As someone that has looked at different models in different countries where they don't have police go to uh, mental health situations at all, I don't think it's a good idea because it for counselors that go to those places, oftentimes they have like a master's degree, they know what they're doing, they've gone through special programming. Like, how can you guarantee like how much like training do cops go through for this? They don't even go in my personal opinion, they don't even go through enough training for like being a cop.
But for the same money that you could train a police officer in some of these crisis situations, you could probably train 2 or 3 crisis workers, right?
Yeah, I will say I did interact with one. What was it? I know that they have a non-emergency person on to the police station that goes to certain mental health situations in Peoria already. I interacted with her, and that was probably the best interaction I had while psychotic. So like,
And she
I do
wasn't a sworn officer.
no,
Okay.
at least to my knowledge, I didn't go in the back cop car. She just took me to the shelter for HSC, Human Service Center, and from there, I was given the option to go to the hospital, which they admitted me.
Well, the option between the hospital and what?
I'll just stay at the shelter, I think.
Oh, okay.
Granted, that shelter's mainly used for like I think maybe domestic abuse or like homelessness, but like they do mainly interact with mentally ill people.
Okay. Well, I think that's all the questions that I have. Is there anything else that, you want people to know?
I do think the co-responder model would be a mistake. Specifically, I'm going to talk about like my autistic. This CESSA was built because police gunned down an like an autistic black teenager. There's not enough experience with autism in the media that's correct. Like if someone's having a meltdown, is a police officer automatically going to think that person's violent when they're just have sensory overload?
All right, I really want to thank Kyle and SJ for agreeing to speak with us today. Just as a reminder, in Illinois, a law called the Community Emergency Services and Support Act, also known as CESSA or the Stefan Watts Act, requires that all mental behavior developmental emergency calls for service that are nonviolent and non-criminal are responded to by alternative first responders. This is a non-police model. We made a video about this. The link is in the description below. The law will go into full effect January 1st, 2023. Thank you so much for tuning in to Agitation Rising. Like, subscribe, and follow the blog strangecornersofthought.com, and we'll see you next time.